Hello everyone, and thank you for joining us for Arthritis Talks, Exercising Safely with Arthritis. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada. Now first, while we've come together for this event from many different places, I would like to acknowledge the land for which I am located on and on which our Toronto office stands, which is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabe, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis people, and I am very grateful to have the opportunity to live with my family and work on this land. Now, living with persistent pain and fatigue can make even small movements feel just overwhelming. But we know the research shows that embracing movement and learning how to exercise safely with arthritis can empower you to reclaim control and enhance your quality of life. That's what brings us here today, to help you develop strategies to be physically active for life. Now, before we get started, a few logistics. This webinar is best viewed on a laptop or desktop computer. If you experience any technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A button at the bottom middle of the screen, and we will try to get to as many questions as possible during the hour that we have together. You can click on the chat icon also in the bottom middle of the screen to access the chat and connect with other participants, as well as our chat moderator. If you would prefer to close the chat, if you find it distracting, just click the X icon to exit out of the window. To enable closed captioning, please click on the Show Captioning icon in your controls toolbar at the bottom of the screen. Now, I want to share something new and exciting. We recently launched our Text to Give option. You can now text PAIN, P-A-I-N, to 45678 to donate $10 to Arthritis Society Canada. It's quick, it's easy, and every dollar supports life-changing arthritis research, advocacy, and programs that help people manage pain, stay active, and keep their independence. People like Tina, whose photo is featured on the screen, remind us why this work is so important. She was born with hip dysplasia and developed osteoarthritis in her 20s. Now 56, she has severe osteoarthritis, which presents like that of an 80-year-old, according to her physician. She's had multiple surgeries and lives with pain every single day, but she continues to face life with incredible strength. When you give, you're helping people like Tina find relief, stay connected, and hold on to hope. You're also helping us bring you Arthritis Talks webinars like this one, creating space and learning, connection, and community. I truly appreciate your generosity and hope you'll consider making a donation today. Now, you are here tonight because you or a loved one lives with arthritis, and you came with really important questions. Many questions that we received in advance followed similar themes, so we will address those first before we go into a live Q&A at the end of the session. And with that, it is truly my pleasure to welcome today's expert, physical activity specialist, Dr. Manuel Ester from the University of Calgary. Welcome, Manny. Okay, first question. Could you start by sharing why it is so important to be active when you have arthritis?
Yeah, thanks for the question, Sean. And happy to speak to this. It's a really important question, and I think first and foremost, it's really important to think about what matters to you when you're living with arthritis and really link physical activity to that, because that's when that motivation can become our own. But going on that, there's kind of some really good common things about physical activity. One of the things that's really valuable is that physical activity, especially walking and aerobic activity, where you're getting your heart rate up, your blood pumping, helps you build a healthier heart. So this reduces your risk of heart disease, but also more importantly, it kind of helps you with the day-to-day to be able to do what you enjoy, to be able to maintain your independence and function if you have that good heart and lung function. The second one that's really valuable as well, we know that lots of people living with arthritis experience fatigue and pain on a daily basis. And this can be a really common challenge, but exercise and physical activity is one of the most effective proven methods to actually counter that. So as you mentioned, it may be hard to get started, but once you do and once you start gradually in a way that works for your body, physical activity can actually help with that fatigue and pain. And then lastly, I think this links to both of those things. Physical activity is proven to help you regain that quality of life and that function and that independence. So it helps to make everyday life easier and more enjoyable.
So thanks for that information, Manny. We do know that many people find it difficult to get started with physical activity when they haven't been active for a while. So what are your recommendations to get started?
Yeah, so I think the number one question, I alluded this in my first answer, is really thinking about why do you want to move more? So we know that maybe an initial boost and a recommendation from a loved one or a healthcare provider can give you that initial spark to think about movement. But at the end of the day, what helps us get started is to think about how physical activity might be able to help us with the things that really matter to us. So whether this might be something like getting to play with your grandchildren more, getting to regain some function, reducing some of the fatigue you're having, or just getting outside and enjoying life and moving and doing that as part of your day-to-day. So once you kind of think about that why, we encourage you to kind of think about how to turn that into a goal. So set yourself some goal, some specific thing that you want to work towards in terms of activity. Maybe it's adding a couple of minutes per day, or maybe it's adding a walk or two every week, and starting with that small achievable goal and breaking it into simple steps. And then you're working your way up from there. We know that some people tend to jump all in and they hear they need to get active and they try to do everything all at once. So I really encourage you to think about starting small, progressing gradually, and then as you progress, actually listening to your body, seeing how you feel and react to that to make sure we're not worsening fatigue or pain or any of those things we're feeling. The other thing that's really important as well is to get help from others. So we know that social support or having people around you, it doesn't have to be people that do activity with you, but it might be people you talk to about physical activity. It might be people that are asking you and keeping you accountable. But think about, what's your network around you? Who can you activate as part of this journey? And then the other thing that's really important, we know that arthritis comes with its ups and downs, and having a plan actually for those ups and downs and how we're going to actually rest and tone down our activity in days when we're not feeling as good is just as important as having a plan for the ups when we're feeling really, really good and what we're going to do. So thinking about both of those things is important. And I think this is always kind of the thing I like to emphasize the most. At the end of the day, the best physical activity is really the one that you'll do. So we know that it's hard to get up and get moving. So finding things that work for you is really, really important.
Yeah, that's so true, Manny. So just following up on that, what about accommodations or adaptations for people who have arthritis?
Yeah, thanks for the follow-up question. This is a big one. This one comes up as you're dealing with arthritis and other things that are going on in life. There's different things that might come up that make physical activity more difficult. And the first thing is to acknowledge that. So the big thing that I like to always start with is that sometimes when we talk to an exercise professional, a physiotherapist, or someone else in your care team, you might hear the word kind of physical limitations. And I really don't like that word because to me, everything we can work around that and we can still work with you through that. So I like to think of it as a physical consideration. It's something to think about, but it's not something to limit us. So that's just a little bit of I think an important mindset change that we need to have. And then in terms of different things you can do, I put up some of the most common kind of considerations that we see people face. And as you can see, all of them have a way to kind of modify and still make it work. So for example, for flares and swollen joints that are really, really common, it's important to think about focusing on other joints, think about gentle range of motion, pacing, things like that can get you through that flare period. For falls, having really good supportive footwear and using walking aids, things like that can be really helpful. Yeah, and then things like chronic pain, it's really about slow progression, pacing, figuring out, yeah, what works for you, listening to your body, how it responds to physical activity, and making sure we're not going from that 0 to 100 and trying to do everything all at once. So yeah, these are some of the common considerations. And if you're curious about more, there's a link there as well, which is actually on a website that we built for people with arthritis, Just One Move. And yeah, feel free to check that out and think about, yeah, how you can turn those physical considerations into something you can work with rather than against.
So if I could just build on that for a second, because we know that flares can be common for people living with arthritis. So if you could just share a little bit more about what kinds of precautions people should be taking while they're exercising during a flare.
Totally, yeah. And we hear this question all the time when working people in the clinic. What do I do? These flares are coming up and down. Sometimes they're worse, sometimes they're not as bad. And what do I do? Should I rest completely? Should I still try to do something? So really, for the most part, unless that flare is really, really keeping you in bed and having really high pain, things like that, then sometimes rest is the best way to go for that period of time. But if you feel like you can still do some movement, there's a couple kind of general principles you can follow. So the first thing is, if you do have a certain joint that's inflamed, that's feeling a little sore, that's feeling a little flared up, you can focus on actually strengthening muscles around those joints without stressing the inflamed joint. So this is where working with an exercise professional might be able to give you some really good tips and tricks. But think about the muscles, for example, in your knee. You have your upper leg, your upper thighs, your quads, different muscles you can strengthen. And if you can do that in a way that doesn't make your pain or inflammation feel worse, there can be benefit to that. And then for joints, as long as you're able to find some motion, try to move those affected joints just in a gentle way through kind of their full available ranges. So that just means as much as is possible without exacerbating any pain during these periods. So that just also helps to get the blood flowing, helps to keep things from stiffening up too much over that period. And then, yeah, importantly, if you are experiencing more extreme flares or more extreme fatigue during this period of time, finding exercise into short sessions throughout the day. So just breaking down, maybe instead of doing 30 minutes all at once, you do a couple 5-minute segments throughout the day. And just importantly, in terms of safety, it's important not to stretch a joint that's really acutely inflamed. So if your joint is really hot, swollen, and painful, stretching that joint is not recommended. So that's just a precaution to have.
Okay. I think we can all relate to this next question. It's one thing to start exercising, but it's another thing is to stay motivated and to continue on that exercise program. So do you have any tips for our attendees about how to keep them motivated?
Yeah, this is a key question. So actually, my focus and one of my areas that I've spent a lot of time thinking about the actual behaviors and the psychology around physical activity, because we know it's really, really difficult in the best of times to stay motivated and consistent. And then you layer on fatigue, you layer on flares that are unpredictable and other challenges with your joints, pain, definitely adds on to that complexity. So how do we stay motivated? There's a couple things. Again, I think this first one I touched on a little bit, but I really can't emphasize it enough. The most important thing here in terms of motivation, in terms of staying motivated, is trying to link things to what is your reason for doing that movement. So again, thinking about what is your reason. There's things like managing fatigue and other symptoms, maybe getting back to some of your favorite activities with family and friends. So it might be gardening, it might be walking, playing with kids, other things. It might be a goal to get outside in nature or just to stay independent. So once you find that personal why, write it down, think about those goals, and that really is going to be your driving force, right? This is something that really is important to you. It's not just about physical activity, it's about actually those specific functional things, those practical things that bring you joy in life. The second thing that's really important, I touch on this as well, is thinking about your movement team. So this is not an individual sport. Having people around you is going to really dramatically increase your chances of sticking with it and staying motivated. And like I mentioned, these don't have to be people that directly are going for a walk with you or taking you to a fitness center. These can just be people in your life that are supportive of you in general, in your arthritis journey, in your day-to-day life. People that just maybe ask you a quick question. What did you do to move today? Or how are you feeling today? Have you done a little bit of walking or something of that nature? That can be all the support you need to stay accountable. And these can be people then that are trusted people you can share your goals and your challenges and things with, and you can have those conversations. And then last, and I think definitely not least, it's important to think about making it fun. So if you think about kind of kids playing on the playground or running around chasing a ball, you see those smiles on their faces. Naturally, movement can be fun and it should be fun. And sometimes when we get into adulthood, maybe we lose that a little bit. So think about finding ways to enjoy your movement, whether it's a social walk with a friend where you're chatting and you're not thinking about movement at the time. Maybe it's doing a silly dance party in the kitchen and putting your favorite music on, or just sticking to things that you know and love. So maybe it's your favorite walk in your neighborhood and just sticking with that. There's nothing wrong with that. Sometimes trying something new can be fun. So just trying to, think about that element, and truly, if we're having a miserable time while we're doing physical activity, that motivation is only going to last so long. So as much as possible, trying to find some ways to make it a little bit lighthearted, make it fun, is going to help you stick to those things.
That's great, Manny. We're going to have a lot of time for questions tonight, which is great. I do like to ask, though, before we get into that, what excites you about the future for people diagnosed with arthritis today?
Mm-hmm. Yeah, I think it's a really exciting time. If we look at talking to, for example, some rheumatology professionals or people that have worked with or lived with arthritis for a long time, things have changed a lot in terms of how we're able to treat and manage and approach arthritis in so many different ways. And that's a really exciting time because our treatments have improved dramatically. But with that comes this kind of a new age where lots of people are living with arthritis. Lots of people are having good quality of life. But the thing for me, and the thing where physical activity comes in as a key part, is thinking about how can we actually help people live life to the fullest. So not just how can we keep that inflammation down and keep their arthritis at bay, but there's so much more to that, right? Like how can we help them gain back their function, retain their independence, and these kind of things. And I think it's a really exciting time to be thinking about that. And I think we see more and more emphasis on not just let's look at your treatment, but let's think about how it can help you live life to the fullest. I'm really excited to be a part of that.
That's great. Okay, well, not surprisingly, we have received a number of questions already. So we're just going to dive right in if that's okay. I think you've shared a lot of really great principles and ideas about how people should approach exercise. We've got a few people asking, I think, how this applies to their own experiences. So first thing, how many days a week would you recommend people exercise for generally, and how long?
Yeah, this is actually it's a good question. This is a natural question for lots of people to ask, but it's actually maybe a little bit harder or vaguer to answer than you might expect. So we know there are physical activity guidelines out there for adults, the Canadian Physical Activity Guidelines, and there's a certain number there. I'll loop back around to that number and that frequency. But the really important thing is that what happens when you give people a certain number and a threshold and a number of days, sometimes that can feel like a lot, or that can feel like a really unachievable number if you're moving from just receiving a new diagnosis or having a lot of pain, having a lot of fatigue. So the really important thing I want to leave with you is that any amount of physical activity is better than no physical activity, and the benefits keep increasing the more you do up until a certain point. So really, I don't want you to be too discouraged by looking at a certain number and trying to aim for that, but trying to add a little bit more movement here and there, trying to do a variety of movements. So that would include things like balance exercises, strength training, walking, aerobics. Combining those different things is really important. So at the end of the day, there are these guidelines. So the Canadian Physical Activity Guidelines recommend 150 minutes of moderate to vigorous aerobic physical activity. So what does that actually mean? This is kind of something that gets your heart rate going a little bit more than just a gentle walk. Something that gets you moving and maybe sweating. That's more that vigorous physical activity. And then in addition to that, they recommend working up to 2 or more days of doing some strength training for different muscle groups of the body. So those are kind of the key guidelines. But again, coming back to this, it's not just about 0 or 100, meeting those guidelines, doing everything or nothing. It's really about thinking, what can you add, what realistically works in your day-to-day, and not being too focused on that, because we actually see a lot of those benefits I mentioned earlier about physical activity, a lot of the value we get out of it doesn't require you to always, every day, all the time, be meeting that threshold or that physical activity guidelines. So yeah,
Okay.
it's important.
Yeah, that's helpful. So again, if someone's starting, how can somebody know their sort of baseline current fitness level? Is that actually even important to know before you're starting to exercise?
Yeah, again, you'll realize a pattern. And I think this is yes and no, depending on what you're looking to do. So depending on where you're coming from and if you've had a conversation with your healthcare professional around it, there might be some value in knowing where you're starting at. But you don't need to do any sort of like fancy testing or things like that. Maybe your standard can be doing a 10 or 15-minute walk and giving yourself a number. How do I feel after that? How difficult was it for me? That can be your own sort of measuring stick for fitness testing. So you can start with something like that. It's good to kind of know where you're starting, but if you don't have the chance to do that, or if you don't feel like you need that, it doesn't mean you can't get moving and do some gentle things. The most important thing, again, for getting started is just being very gradual with it. So after we receive a diagnosis of arthritis, or if we have an extreme flare-up or something that really sets us back, just starting gradually, giving yourself grace that it might not be right back at that level where you were before, starting slowly, and then really like being in tune and listening to your body. So that means after you do an activity, how do you feel? How tiring was it? How difficult was it? Is there any kind of pain and things that are sticking around that are a sign of being really exhausted afterwards? So it's really about starting gradually, finding your own personal way. And I find, people that start to learn to do that and acknowledge how do they feel, how can I kind of slowly build on, that is really going to empower you to then gradually build up to the level where you want to be.
Okay. So if somebody is thinking about starting to work with a physio or a trainer, is there any particular health information, health history that they should make sure they're sharing?
Yeah, this is a great question, and I think the number one kind of tip I have here is that when you are working with an exercise professional or physiotherapist or kinesiologist, if they're not asking you for quite a bit of information up front, that maybe is a kind of a bad sign, because the best of their ability, they should be asking you about all kinds of different things around your health, just to get a sense and be able to personalize and tailor to you in the best possible way. So first and foremost, if they're not asking you for too much, I would say try to share as much as possible with them, at least what you feel comfortable sharing. And then, if from there, that's kind of like a good starting point. But in terms of, specific information, I mean, there's kind of a standardized different screening that they should be doing with you, but things like, any medical history, of course, medications you're taking, any injury, fall history that you have, that's kind of like a starting point for basic safety. And then from there, getting into things like thinking about what activities you did in the past, what's important to you, that kind of motivational piece. Those are the conversations you want to start having with. And again, I encourage you, this is kind of a really good measuring stick for yourself to have some power in this conversation too, is actually getting a sense of what questions they are asking. And if you feel like they're not asking quite enough, sometimes that might be a sign that it's not the best exercise professional to be working with. Not always. I'm not saying that as a general statement, but it's a good starting point. If they're asking you lots of things, if they're trying to get a sense, they're really making an effort to make it personalized to you, which is a good sign.
Yeah, that makes a ton of sense. What about, are there assistive devices or aids that people commonly use to help them maintain their mobility while they're exercising or otherwise that you would recommend for people with arthritis?
Yeah, again, I think that there's a lot of different equipment and devices people can use, which is amazing, which is great. The main thing here is, again, trying to work with a physio or have a specific conversation, because the way each person moves is slightly different. The exact nature and severity of the different considerations is so different. So it's really hard to kind of give a blanket, this is a good device for everyone. But for example, when doing something like strength training, which often involves like holding weights in your hands or holding bars or things like that, one of the things we see a lot for people with inflammatory arthritis that have problems with their hands and joints and stiffness there is the ability to use resistance bands. So instead of having to hold a really heavy weight, you can use a resistance band, and you can actually tie that resistance band around your wrist instead of having to hold it in your hand. So that's kind of one of the things for strength training. There's also kind of wrist or ankle weights that you can actually kind of Velcro and fasten to that instead of having them in your hands. So those are just some kind of general considerations and modifications that you can make depending on how you're feeling. And I think that the most important one, generally speaking, I think, is really thinking about footwear. So we know a lot of people have maybe balance challenges, or they have considerations with swelling or pain in their feet or things throughout their knees and hips, and often having really good footwear. So going to a good store and having a good conversation with someone that's actually experienced about finding good footwear for people with arthritis or people with other considerations, that can go a really, really, really long way. And we know that, yeah, going on long walks and standing a lot and doing these things with poor footwear or footwear that's not supportive for you can just make other things worse. So that would be, I think, the number one and the simplest thing, that everyone can go out there and find footwear that works for them.
Okay. So building on this safety sort of theme, if you're in Canada, we're approaching winter. So a few people are asking here about whether there are ways to exercise safely outdoors in the winter that you would recommend. Do you have any tips around that?
Yeah, this is a good question, and I think a very Canadian relevant question. You know, we have ice and snow building up. So I think, again, probably my number one thing comes back to footwear. I think there is really good ways to at least improve your stickiness on the ground with footwear. So there's footwear that has specific kind of rubber that works well in ice and cold temperatures, or there's, just the old classic kind of spikes or micro spikes that you can put underneath your feet. So I think that's the number one thing, being pretty cautious about that. Having good footwear with good grip is always helpful. And yeah, if it's really, really icy and windy, and you know that you're in an area where there's lots of hills or things like that, it's maybe just choosing the right days and times to do it as well. If you know that that's a time when it seems really, really risky, it's maybe good to slow down, maybe do some things indoors for the time being. But yeah, I think those are kind of the two best ways to go about it. And then, of course, I think there's also lots of other activities that you can do, that things like snowshoeing, for example, or other activities that maybe are a little bit less in your neighborhood streets, and where it tends to get a little bit more icy, where there's lots of cars and things like that that are heating up and melting and thawing the ice and things like that. So yeah.
Okay. I think we have quite a few people joining us who have osteoarthritis in one or both of their knees. So picking up on the walking theme, questions about is walking on a treadmill okay or on harder surfaces outside? People are just trying to explore what their options are.
Yeah, this is a tricky one for sure. So I think first of all, there's, this is again to have a conversation and monitor for yourself the way people, yeah, present and the difficulties and the level of pain people have with knee osteoarthritis or hip osteoarthritis varies quite a bit. So I think the really, really important thing is just to, again, monitor what things feel like during and after your physical activity. That can give you a really good sense. So when it comes to pain, kind of one of the thresholds, and I talked with a physio on our team about this recently, one of the things we want to think about in terms of a threshold is like kind of like your perceived pain in that knee should never be above kind of a 4 out of 10. So if you put that 10 as kind of like maybe the worst pain you've ever experienced, 1 is pretty much nothing. Just trying to keep track of that. So as you move, listening to your body and seeing how it responds. So that would be kind of my number one tip, because ultimately it depends on you and there's so many different things that might make it better or worse. But then otherwise tips I would have for people is thinking about if it's possible, again, in the winter it's a little bit harder, but if it's possible to find softer surfaces to walk on. So there is, walking on the road or the sidewalk is one of the hardest surfaces. So if there are trails around you, or if you have the ability to walk on the grass or other surfaces, trying to do that to reduce the impact. And then, of course, worst case, if you are just kind of experiencing a lot of pain or challenges with the knees or hips, even when you're walking on soft ground, even when you're, sticking to those different things and monitoring your pain, there's a lot of ways to be active that are really low impact. So trying to see if there's ways you can do any sort of water-based swimming, aquatic exercise is really good. Doesn't have nearly as much impact, or if there's things like biking on a stationary bike or things like that. And then again, like last and not least, it comes back to footwear again. Like the more supportive and the more suited your footwear is, and there might be an insole or there might be other things. Sometimes it's actually what makes it is worse is actually just the way that your foot isn't supported or isn't sitting right in your shoe, right? Or you have some things going on around your ankle because of the way that your footwear is tilting your feet can make a big difference. So going to a good, kind of running store or a good trusted store that sells supportive footwear and having them help you pick something out, sometimes that can make a big difference. So yeah, hopefully 1 or 2 of those tips are practical and you can think about how to integrate those.
Okay. Actually, building on that, so we talked about some mobility devices. Are there other ways that people can think about protecting their joints while they're exercising?
Definitely maybe I'll take this question. Oh, I'm just waiting. It looks like my connection is
I can still hear you, Manny, actually.
waiting
So
till I
go
come
ahead.
back here.
We'll
Sorry.
wait for it to come back.
Okay, perfect. Yeah, so there's kind of 2 parts in terms of devices and safety. One of the things that's really, really important actually is trying to do some strength training. So strengthening the muscles around those joints can actually help a lot. So sometimes people think they're experiencing challenges in certain joints. They just kind of try to go more towards, they want to avoid activities in those areas, but building strength and strengthening your muscles and things like that can be really valuable. And then the other thing that you can use, that there are things like braces, right, that you can have around larger joints, or there's kind of wrist guards or wrist braces and things like that. Yeah, so some of the things you can think about.
So quite a few people are asking about, specific pieces of exercise equipment, whether there's any kind of, I would say, contraindications around arthritis. So whether it's ellipticals, treadmills, stationary bikes, those kinds of things. Are there any kind of general rules that you would share with people around trying those different devices or machines, I guess?
Yeah, it's a good question. Again, I think generally speaking, there's certain exercise equipment that has a little bit more higher impact. Things like the treadmill, especially if you're going at a higher pace on that. So if you're having any issues, if you are using a treadmill, you can think about things like a bike or an elliptical or other machines that don't have such high impact. Generally speaking, I don't think there's kind of broad safety concerns with any of these machines. But of course, it's a very individualized thing again. So trying things out and going from there is kind of the best way to go. And all of those machines can be used for different people at different times. And generally speaking, they're all kind of providing that function of getting your heart rate going a little bit, allowing you to do activity maybe in those winter months indoors. So yeah, I see them all kind of as useful tools, but again, it comes down to, especially if you are using a treadmill that can be a little bit higher impact, or maybe if you're using a stationary bike and it's not quite set up in a good way, there can be challenges. It can make your knees or hips feel worse afterwards. So a good measure is just to always keep track of, how your pain and soreness feels in kind of the 24 to 72 hours, the 1 to 2 to 3 days after doing physical activity. And if you don't see that kind of soreness and pain go away, that's probably a good sign that there's some element there of overdoing it, or there's some element of maybe either how the machine was set up or how you were walking or running on it that might need to be adjusted a little bit.
Yeah, so we get that question a lot. How do you know when, it's too much pain? So I don't know if you have any advice about either, heat, cold, post-exercise, or just really knowing when you push it too far.
Yeah, it's a really good question. So maybe I'll start just by kind of differentiating. So when we do physical activity, there's kind of two things we can experience. And the first is actually muscle pain. So this is normal as a response to doing physical activity, especially if you're kind of doing a new activity or ramping things up. So this should be kind of general soreness in your muscles. It shouldn't be kind of like a stabbing or specific pain. And this can happen from between kind of 1 day to 3 days after you do an activity. Or if you increase the intensity, if you increase how much you're doing or how fast you're going or things like that. So this is a natural response to physical activity. It's actually a good sign. It means that your body's learning, your muscles are actually adapting and responding to that activity. And so that's kind of differentiating between good soreness or pain. And then the other side, of course, is joint pain. So this is when you have joint pain, this is going to be specific in those joint areas, not kind of around the joints in the muscles. And this is always a sign of caution. So you might experience things like grinding or clicking or clunking in the joint. And then this might be associated with pain or swelling during the activity as well as after the activity. And this is a sign that there might be some additional harm. There might be some kind of more intense strain on the joints than you want to be seeing. So that's really important. Kind of people experience pain or soreness, and it's important to think about what is it actually, and is it something that might be a positive response, or is it something that might be a sign of caution? So generally speaking, with pain, I come back to that number of thinking about during your activity, you want to keep pain below 4 out of 10 at its worst. And this depends a little bit on the person, but generally speaking, if you see that pain kind of go up and go above that threshold, it's generally a bad sign. And then you want to really avoid activities that cause any sharp or shooting pain. Like I mentioned, that muscle soreness, that kind of good pain should be kind of broadly, evenly throughout your muscle. It should be general, more feeling of soreness and not super, super intense. Pain that actually eases with activity. So sometimes it might be like a thing of stiffness. As you start moving, it feels a little bit more painful. So if it eases with activity, that's also a good sign. But again, if it worsens with activity or lasts longer than that kind of 3 days threshold, we want to think about modifying, and we want to think about especially if that pain continues to go up, of course, then that's a sign to think about seeking medical help or getting some support around that. But yeah, there's a lot of complexity around pain. So the main thing is just to try to keep track throughout your movements and try to think about, is this muscle soreness or is this joint pain, and is it getting better or is it getting worse throughout my activity?
Okay, I'm going to ask another question along the theme of pain then to add to that complexity. There are people expressing that they don't actually feel pain during the exercise, but 24, 48 hours later, they're sort of experiencing delayed pain. So do you have any recommendations about how people should track that, or how to determine what is actually causing that delayed pain?
Yeah, I think we're starting to get into this discussion where like pain is such a complex thing. There's so many different things that factor into it. There's even your temperature, maybe your day-to-day, there's so many different pieces. The amount of sleep you got factor into the pain response. And so it's such a complex thing, first of all. So it's really hard to speak to it in a general sense. But again, the same general advice would apply in this situation, is that you want to keep track of where is that pain occurring. Is it kind of that broad pain or soreness in a muscle that starts to get better and go away within 2 to 3 days? Or is it something that's more kind of sharp, or that you can really feel it's in the joint specifically? Then again, that's a good indicator. And if it's something that generally lasts more than 3 days, 4 days, that's usually a good indicator that that's not, a healthy response. It's more of a warning sign that the body is sending you. So yeah, without having the whole full picture, like again, I think a reminder that pain is so complex, but generally speaking, try to keep track. And even we know lots of people keep like a little bit of just like a log of 0 to 10. How's it feeling in the morning, afternoon, evening? And then maybe we start to notice it's starting to go away a little bit, or maybe we actually reflect on something that happened before the physical activity that might actually be related to that pain as well. So lots of things going on there, but just keeping track for yourself and keeping an eye of where and how bad that pain is a good indicator.
Okay. What about any recommendations for how to get your heart rate up? So doing that cardiovascular exercise when even things like walking can be painful.
Yeah, it's a really good question. Depends again what you're able to do and what feels good. Again, listening to your body and building up gradually is really, really important. You don't want to kind of sacrifice getting your heart rate up for having a lot of pain or worsening pain in your knees or other joints. So again, kind of probably number one advice is trying to think about lower impact alternatives that I talked about before a little bit. If you do have access to a pool facility, can you do things in the pool that are going to be really low impact? Or if you don't, can you do things in kind of an exercise equipment that allows you to be like a stationary bicycle or an elliptical that are generally speaking lower impact. But then the other thing actually is that you can get your heart rate up pretty well if you're sitting in a chair and you're moving your arms, or you're moving your arms and legs and doing different things. So there's actually a lot of ways to kind of think about that and get your cardio in. I've worked with a lot of people where we do some aerobic movements in a chair, and we can definitely get that heart rate up. So think about those different alternatives for doing that. And again, don't try to do things that are gonna get that pain above a 4 out of 10 and continue to cause you pain and more damage in certain joints. And I think best practice, if you are one of these people that's really kind of not too sure, you've tried different things, you're not too sure what's safe, what's not safe, working with a physiotherapist or exercise professional, at least to get you started, at least to kind of keep track of that in a more safe way, is always a good way to go. So if you're able to access one of those professionals, and nowadays there's also, I think, lots of ways to at least yeah, get some consultation and some support in an online environment. So even if you live in a more remote area and there's no physio or exercise professional nearby, maybe you can still have some of that conversation or have some supervision that happens online.
I'm glad you brought up chair exercises because a few people have asked about them. So could you just elaborate a bit more about, what specific exercises people could maybe think about trying for their arthritis?
Yeah, so I think the main thing is over the past years, I've ran a lot of exercise programs one-on-one and in groups with lots of people that are doing chair movements and then doing it standing or doing a combination. So the main thing is that you can do not everything, but almost every type of physical activity you can actually practice in a chair. So there's things like stretching and flexibility. You can do a lot of different stretches and mobility exercises in a chair. You can do strength exercises in a chair, and there's lots of good videos out there online as well. I know the Arthritis Society has some seated physical activity videos, and other areas do as well. So yeah, there's lots of different things you can do, and just if you're not able to kind of stand and weight bear for that period of time, there's still ways you can stay moving. There's fun aerobic dance videos that you can do in a seated position, and all kinds of things. So I think there's I think that's a big message, is not to be discouraged if you're in a day where you need to be seated and there's more pain or there's a flare up and you just like standing up just makes it worse or whatever. There's still ways you can keep moving and get creative with it. And nowadays there's a lot of different good examples of doing movement in your chair. There's chair yoga classes. It's all out there, and there's lots of different people that are able to adjust and help you to do the right physical activity and enjoyable movement, even if you're doing it in a chair.
Okay. What do we know about exercise and sleep? Does it generally help you with sleep? Could exercising too late give you trouble sleeping? Yeah, what do we know?
Yeah, again, it's a really good question. Sleep is an important part. If we, for example, go back to, I talked about the Canadian Physical Activity Guidelines earlier in the talk, and actually for the past few years, what that group that puts together these recommendations has actually changed is actually to think about what does a 24-hour day look like. So not just physical activity, but actually sleep, sitting time, standing time, and physical activity. All of these things we know are really interconnected. So thinking about sleep is so important. First of all, sleep is a really key part of resting and recovering if you are doing physical activity. So sleep quality is going to help you kind of recover, and having enough sleep is going to be a key part to actually staying active and being able to do that on a regular basis. And then the nice thing about this is actually it kind of goes both ways. It's kind of a positive feedback loop, right? If we sleep better, if we're able to find that rest, then also it's going to help us to be able to do more activity, but then also physical activity we know actually helps with sleep quality. So yes, there is, I think, some of those considerations around being really, really active late at night and having your heart rate go up. You've probably experienced this in your own physical activity, is that it does make it harder to fall asleep after for a period of time. But generally speaking, doing some physical activity throughout the day, it's a way for your body to get some of that energy out. It's going to improve your sleep quality as well. So there is some pretty good research around this, and the nice thing is it's kind of that positive feedback. So you don't have to start with physical activity. You can actually start with thinking about sleep and those different things, and then that in turn is actually going to give you a little bit more energy and allow you to do some of those activities.
Okay. So you touched on rest and recovery just now, and also in your presentation a bit. So how do people know if they've had enough rest and recovery? That's kind of a sign for them to get back at it.
Yeah, there's a lot of ways to look at this. first and foremost, again, recovery is really, really important, and rest and giving yourself grace when you're not feeling so well, or when you're in a flare, or when you're really fatigued on a day. So again, these two things play together. And if you love doing physical activity, if you love getting out for your walks, you also need to find time and space and prioritize rest and recovery. So I think that's a really important piece, and these two things go together. It's not like if I rest, I'm being lazy, or I'm not doing something, or I should feel bad about taking a day off if I don't feel so good. Rest is kind of an essential part of that, right? As well as sleep, resting throughout certain days is really essential to being able to have a healthy physical activity routine and to be able to function well. So yeah, it's an important part. And to your question kind of around how much rest, how long, again, this is really, really difficult to speak to directly, but generally speaking, the best way to go if you are doing a variety of different physical activities, we generally advise, for example, for strength training. So if you're doing weight training or with resistance bands and working on certain areas, to give yourself a day of rest in between kind of repeating those same activities. That's kind of general best practice and a good way to go. Gives your muscles kind of that 48 hours, 2 days to recover. And it might be different if you're just getting into doing strength training for the very first time. You might need a little bit longer. And then for the same thing for kind of doing more higher intensity, so things that really get your heart rate going, that get you sweating a little bit, or really are hard for the heart and the lungs. It's also, if you're doing an intense effort on one day, maybe your rest can be just a very gentle movement the next day, or something that doesn't get your heart rate up quite as much. So generally speaking, kind of alternating days is a good way to go, a simple way to go. But again, listening to your body and acknowledging when maybe you're getting sick or there's other things going on, you might need a lot more rest than that. So generally speaking, yeah, rest is a good thing. And when your body is kind of telling you it's a good idea sometimes to take that rest. And then, yeah, intersperse that physical activity in between as well.
Mm-hmm. That makes a lot of sense. Quite a few people who are listening seem to have heard of the GLAD program. So wondering if you could just share just a second about what that is, and if any thoughts about programs, GLAD or programs like GLAD for arthritis.
Yeah, so GLAD it's an evidence-based program. It's a program that was originally developed in Denmark and has been brought to Canada, and it's been tested extensively in Denmark. It's been tested extensively in Canada. The main thing is that this is a program for people living with osteoarthritis. It's a structured physical activity program that is delivered both online and in person in groups. And this is, been shown to be effective. It's tailored towards people with osteoarthritis. So it's people that are going to be helping you or have specific knowledge and expertise around osteoarthritis. And it's generally speaking kind of adapted to those different considerations. So it's a good starting point, especially for people with osteoarthritis. It's a program that, as far as I know, is kind of broadly accessible in many different parts of Canada. I don't know exactly where it might be a little bit less accessible. It's certainly not everywhere. But yeah, it's a good starting point, and it's a good kind of broad level physical activity program that can provide you a starting point, can provide you a kickstart to get moving again, and provide you some specific tips and tricks and ideas around physical activity with osteoarthritis specifically. So yeah, it's a great program. Unfortunately, we don't have the same kind of programming for inflammatory arthritis, but it's something that we hope to change in the future.
So Manny, I thought for my last question, I would ask you, could you share a little bit about the site that you've just launched, what it is, and why you're so excited about it?
Mm-hmm. Yeah, I think this is a perfect segue. So we talked about GLAD for osteoarthritis. What we developed is a website called justonemove.ca. This is a website that was developed by a research team here at the University of Calgary, where I work, that includes exercise specialists, it includes rheumatologists, and it includes lots and lots of people that are actually living with arthritis. So we developed this website together as a team, and we really listen to the voices of the people who have that lived expertise of what does it feel like to live with inflammatory arthritis, rheumatoid arthritis specifically. So what this is a really practical, actionable website. It has a lot of different movements you can do. It has some motivational tools that can help you plan for how do I do physical activity, what does my motivation look like, some really practical pieces. And then also it has some really cool real life stories of people that are living with different types of arthritis, and some of their stories for how they're dealing with different challenges that come up, how they're staying active, how they're staying motivated. And that can be really inspiring to see how other people are dealing with things. It might give you some really cool ideas or some inspiration to incorporate into your own day to day. So I encourage everyone to check it out. It's made for people with arthritis by people with arthritis, and I think that's a really powerful piece. It's practical. It's not just another piece of information, but it's really designed to empower you to take a move in the right direction. And there's really simple movements. Everything on there is tailored to arthritis and has been vetted by experts that it's safe and valuable for people with arthritis. So it's a really cool starting point, and we're really excited about it because our ability to create it with the people that need it most, and we're looking forward to have lots more people use it, sign on, and share it with their friends and families as well.
That's great, Manny, and we'll certainly make sure that everybody here knows how to get to that. So thank you again, Manny, for sharing your knowledge with us today. We would like to take just a few moments to get the audience's feedback on today's presentation. So for those of you who are live on the Zoom, you'll see a poll question come up on your screen with some answer options. So do click on the response that reflects your thoughts. I feel more knowledgeable and empowered after attending this webinar. Let us know how you agree. We will also be sending you an evaluation form when we email the recording and the slides. So if you weren't able to access the poll question, don't worry. You will have the opportunity to give us feedback then. We do use the survey feedback to shape our future Arthritis Talks webinars and truly, truly value your input. We will be back again on December 3rd for an Arthritis Talks focused on medical cannabis. So stay tuned to your email for more information on that webinar. Once again, we are so grateful to our donors for their financial support of this event. This concludes tonight's Arthritis Talks. On behalf of all of us, thank you for joining us today, and please stay well.